Is there any way better to have an impact on the society than saving lives? I am sure many will agree with me that saving lives should be top priority. Hence the common conviction that the main responsibility of any government is the protection of lives and property of citizens. Now, on an individual level, you can play a significant impact by donating blood to save the life of someone in need, or even many others. But it is not just about donating blood. The donation has to be safe and of high quality to save a life. Well, this is the primary responsibility of National Blood Service Commission to ensure. And on the spot, we will seek to know the understanding, the mandate of the regulatory body. I am Joseph Wotsem. Welcome to the program. Now, my guest is a trained medical doctor, administrator, and leadership mentor, a graduate of medicine from the University of Jos, and holds a diploma in advanced leadership skills and management from Singapore, postgraduate diploma from the University of Liverpool, UK, master's degree in public administration, Olabisi Olabanjo University, and Doctor of Philosophy International Relations from Atlanta International University, Hawaii, USA. He also obtained certificates from many professional institutions, including Certificate of Member of the National Institute for Policy and Strategic Studies, Strategies in Health Development from China, Certificate in Current Issues in Development, Haiti Institute, USA. On the spot is the Acting Director General of National Blood Service Commission, Dr. Omale Joseph Amedu. Welcome to the program.
Thank you for having me here.
Okay, that's great. You're welcome. Okay, when you talk about blood donation, you see people just go to the hospital to donate blood, or hospitals asking for blood, and then people just go in there and donate, and then sometimes they just go ahead and use it. It's good to save life, quite all right. And now when one hears about the commission, the person will be wondering, what is now the mandate of the commission? If people just go to the hospital, just donate blood, or the hospital will now just request for blood, what would the mandate? Can you just give us an insight on the mandate of the commission itself?
Thank you very much, Joseph. You've said earlier on that saving life is a responsibility of both the government and every individual, and giving blood to save somebody's life is a big sacrifice in saving other person's life. Blood is life of every living organism, and as for human beings, whatever your background in terms of education, your color, your religion, and whichever part of the world you come from, it's the same blood that runs in the vein. So blood is life, and it saves life. Now, blood is an essential commodity that you cannot find it in the market to buy, except somebody who has it willingly give to someone that needs it to save his or her life. And the good thing about giving blood is that when you give blood, you may not even know who is going to be the recipient of that blood. So you are saving an unknown life. And I tell you, this is a miracle, because I call it a miracle because for you to give the blood from your system in favor of somebody you have not met before, you don't know where he comes from, where he is, the reward cannot be done in a monetary form. Now, to tell you why the National Blood Service Commission came into existence, yes, people walk into the hospital to donate blood for their relations, son, daughter, husband, and other relations. But you see, there are several diseases that can be found in the blood, germs that can be found in blood of different types, microscopic or otherwise. And if wrong blood are transfused into a recipient's body, it causes more trouble than when such a person initially required the blood. So this came to the attention of government because there are several complications through our hemovigilance research and activities. Government is now aware that the blood has to be given in a safe and high quality to enable it provide the need why that blood in the first place transfused. So government has put in place a machinery to regulate the transfusion of blood, the giving of blood, who gives the blood, who receives the blood, who processes the blood, how is the blood processed, is it properly done or otherwise. So it's the responsibility of government to make sure that these things are provided in a safe way to give to the patient so the patient can be safe after receiving the blood. And therefore, government put in place this commission called the National Blood Service Commission in 2021 through the National Blood Service Commission Act 2021. And this act provides a mandate, 3 core mandates. The first is to regulate the provision of blood services. The second is to coordinate all those who are involved in providing blood services in the country. And the third is to ensure, through advocacy and sensitization, that blood is made available to whoever needs it in every part of the country. And I'll give an example. We are here in Abuja City. We have relations that are in the villages, local government or wards, where there are no facilities at all to provide good quality health care to them. Now, these places also, when our mothers or our wives go to the hospital to give birth, they require blood. This blood has to be safe. Therefore, it's the responsibility of government to make sure the blood are available in every corner of the country in safe and of high quality. That's why the commission is in place.
So how do you ensure that safety now? How do you ensure that safety? Is it that you go to the hospitals and look at their blood banks and then you now check tests to find out or what? How do you ensure that?
Thank you very much. Since the coming of the National Blood Transfusion Service, then National Blood Service Commission, there are parameters, there are protocols, there are standard operation procedures, there are indices that we put in place that they have to be followed to ensure that when blood is received from any donor, that blood goes through a process of storage, process of screening, process of distribution, and process of transfusing whoever is going to be the recipient. So there are key indices that people must follow to achieve a safe blood for the patient. And that's what the commission is making sure that is implemented to make sure the blood is available in safe and quality for the country.
Okay, I think the commission came into existence as 2021.
Right.
As a 2021 act that established the National Blood Service Commission.
That's right.
What would you say has been the difference since then when it comes to the issue of transmittable disease through blood? What has been the difference then? What impact has it had so far?
Oh, there's been a lot of impacts. Now, before the commission came into existence in 2021, there used to be a national blood transfusion services since 2005. And that has been providing blood services for the country, like every other person providing blood services. And like you will know, donating blood is not an easy task. There are several myths and confusion among people who donate blood. So people don't really donate blood. But since the coming up of the service, there have been lots of sensitization, advocacy, winning people's heart, telling them that this is right, because people think differently when they donate blood. But over time, people have been donating blood. The number of persons that have been voluntarily donating blood have been increasing. And we're happy to say that Nigerians are very good at responding to critical emergencies that saves lives. So the commission, rather the service before the commission, has over the time actually been involved in providing blood during emergencies. You will recall in 2014 when there was this bomb blast in the UN House and other places. It was the commission that provided the blood that enabled transfusion of those that needed it at that time. So this is one of the things that the commission is doing. But then there was no appropriate regulation to all the people that are providing blood services. And I tell you, every hospital provides blood. Every big hospital, small hospital, they all provide blood in one way or the other over time. But now government wants a comprehensive coordination of this center so they can have a national identity, a national data, a national information on how many bloods are available in the country, who is involved in blood business, who is transferring, what has been the incidences through our hemovigilance activity of people that are giving blood and people that are receiving blood. Because when you give blood, you can have reactions. When you receive blood, you can have reaction. This has to be harmonized so that you can have a seamless chain of safe blood transfusion for the country.
Okay. Blood, you just talk about who is in the business of preserving blood.
All right.
Can this be run as a private business?
Thank you, Joseph. This is actually a very important question, which many people have been asking, and I'll tell you. Yes, blood can be provided by private sector people. And one of the things we are doing as a commission, and one of the things that the Act mandates us to do, is to ensure that through public-private partnership, we're able to make blood available to the country. Now, I was talking about blood. Maybe what you understand by blood is the one you take from the people. You take a pint of blood from somebody and transfer to another person. Not just that. We're talking about blood and blood products. When you have a bag of blood, or a unit of blood, or a bag of blood, for understanding, when you have a unit of blood, inside that one unit of blood, there are several drugs in that pint of blood. Okay. So what we are doing and what we are advocating people to do on PPP basis is to convert this whole blood unit into the component of the blood, so that the whole blood cells, plasma, plasma concentrate, and other products that are contained in that blood. When that is done, you cannot give a single component of the blood to somebody who requires it. Because many times when somebody wants blood, it's not just the whole blood he needs just a component of that blood to solve his or her illnesses. So we are converting this whole blood to different components, like platelet, like plasma, like red cells, like factor 7, and other products that can be singled out and transferred to the patient. And I tell you that in the blood, like I said, blood itself is a drug, and that drug is what we require for transfusion. And that is why you will notice that within the hospital setup, whichever section of the hospital a patient gets to, is it maternity in obstetrics, is it children, is it adult surgery, is it cancer, is it sickle cell, is it medicine, every area you require blood or blood product to take care of that. So blood is very essential. And so the issue of the private sector coming is very critical to make blood available within the entire country. And that is why one of the critical mandates of the Commission is to ensure the availability of blood and blood products. By so doing, we as a commission, we are not supposed to provide blood. And Nigerians need to understand that. Ours is to control through regulation and coordinate. Then the aspect of ensuring the availability of that blood and blood products is for us to, through sensitization and discussion with partners who are interested, to now put in place facilities that can make blood available. So an individual or a company or a group can come and establish a blood service. Ours is regulated. But I must emphasize here that blood is not for sale. It is illegal to sell blood because blood is life and you cannot pay for blood. What we do is to have what we call access fee. Access fee is a small amount to enable people who are providing blood to sustain a production. Because blood, to provide a single unit of blood, costs between 60 and 70,000 naira within the current market rate to provide 1 unit of blood. So you can see that if one patient is asked to bring 3 pints of blood or 5 pints of blood in major cases, it's going to be difficult for an individual to do that. So that's what we are trying to make sure that people actually understand and go into blood service across the country. However, the product, which is either plasma or platelet others, are going to have a cost to them because they're not just ordinary blood, they are already processed to take care of specific illness of the body.
Okay, we'll still talk more about this. This is your private partnership, but we'll come back after we take this short break.
Yes,
okay, stay with us. We'll go for a break, but we'll return soon. Now, welcome back. We have the Acting Director General of National Blood Service Commission, Dr. Omale Joseph Amedu, on the spot. Now, before we went on the break, we were talking about the public-private partnership. Now, you talked about the blood not for sale. But if someone has to go into that business, you have to establish something. Maybe you have a structure, you have facilities, you have testing, that it costs you. He should be able to get something back, even though he's serving the society. How do you reconcile that?
Again, Joseph, that's a very good question because it will help our viewers to know and to see whether they can go into this service or not. Like I said, blood is not for sale. And there's a regulatory body that regulates blood services. And I did mention about the access fee. I'm talking about the volume. Nigeria has a population of over 200 million. And by the WHO standard, that's World Health Organization standard, every country needs at least 1% of its population to have enough blood up to 1% of its population. So if we are 200 million, for example, we need at least 2 million units of blood to take care of Nigerian blood needs every year. So we will expect that through the access fee, which is being regulated, of course, not fully now, but we are regulating and will fully put a tag to the access fee. Now, the volume is what matters. And we're not trying to make a lot of profit on that because blood is life. So it's not everybody that can fit into that kind of business. So if you are not prepared to sacrifice, you don't go into it. Because it's not a business venture that can be giving you a large turnover, a large profit. But it will still give you enough resources, enough profit to be able to keep the service going across the country. And that's why I've said earlier on that the blood products are not going to be free of charge. And I can tell you, a unit of platelet currently costs more than 400,000 naira. They are not available. People send abroad to South Africa to get platelet to the country. But it's something that an individual who wants to invest can get the equipment, get his space, follow the due process, follow the integrity steps by step, and produce a platelet. So if many people are involved in that, of course the price will crash because there are many providers. So we're encouraging people to come into it and make this available. Now, you also know that return on investment depends on demand. There are a lot of demand for blood and blood products across the country because as long as human beings are alive, there are diseases of various types that require these things. So many of Nigerians that travel out for treatment of several sorts, they go for illnesses resulting from blood issues. And I can tell you several of them. In fact, over 70% of people who go out for treatment in this country, they are blood-related issues. Cancer depends on blood products. Cancer, you see, depends on blood products. Sickle cell depends on blood products. Many blood is crazy, other blood disease depends on blood products. So people can invest in this. And over a period of time, you don't get your returns in one day. Over a period of time, if you properly do your strategic plan to ensure that your investment and returns over a period of time, definitely blood is a good business. Blood products.
How much of this are we seeing in the country in terms of the private sector involvement? How much of this are we seeing now? Because you are responsible to sensitize people into this.
Yes. For now, it's actually very low. Look, we did a random statistics in 2018, and we discovered that from the central bank, Nigeria spent over $2 million on importing blood products to the country, 2018 alone.
That's quite much.
So you understand what I mean? But people are reluctant or they don't understand the basics or the intricacies of the blood issue. I know many times people want to import than producing. And if people got into this public-private partnership indices and commence the production and the manufacturing of the plasma-derived medicinal products, which are specifically drugs controlled by NAFDAC, it's a good business. It's like producing drugs, manufacturing drugs. So there are three types. There's the whole blood, there are the blood components, which are not really drugs per se, and there are plasma-derived medicinal products, which are drugs in injectable forms or in topical forms or in other forms. So that is why government has said, look, it's the responsibility of government to put up a system to control, to coordinate, to regulate, and ensure that this is available. Government can do it. Nigerians can do it. All we do is to continue to sensitize people and for government to also continue to primarily invest in this aspect of the economy because it is central to every therapy you give in the hospital. And if that is done and the products are available, definitely the economy will improve. The life expectancy of the country will improve. The health sector will improve their services.
Okay, let's talk about data. And then I'll use a particular disease as an example. Let's take HIV and AIDS. With the regulation, with the blood donation and so on, how much of this has helped in us establishing the status of the country? Or there should be a link between the screening, testing, and then at the end of the day, equally keeping the data. How much of this has it helped for us to establish our HIV status in the country?
Thank you very much. You know, before the National Blood Transfusion Service came into the country, it was actually as a result of the HIV that came up in the mid 80s, or mid 2000 yes, rather late 90s into the 2000, and that's why PEPFAR, which is the program of US Center for Disease Control and the Federal Ministry of Health, had a collaboration to ensure that we are able to monitor the transfusion and transmission of blood. Because HIV is transmitted through blood. And therefore, if blood that are safe are transfused, it means there will be less transfusion. And that's why we're insisting on the safety and quality of blood that is transfused. So over time, we've been collaborating with our other sister agencies like NACA, like NASCAP, and other agencies that are dealing with HIV. We keep our data of those that are positive and those that are negative or that are reactive or non-reactive, and we'll send them for confirmation to make sure that those that we discover that are either reactive are actually confirmed, and those that are confirmed are sent for appropriate treatment. So there's this collaboration between, intelligence collaboration between us. So we have data on those that are reactive and those that are not reactive, and we'll share those data through the activities of the other sister agencies. Of course, as you know, the HIV is actually reducing, and in fact that drastically reduced, and it will continue to reduce until we get out of this menace.
Okay. We're talking about sensitization. We may sit here in Abuja and talk. Yes, actually, NTA has a very large viewership, but how much of this have you been doing in terms of especially reaching the grassroots, where you yourself attest that a lot of facilities are not there?
Yeah. Thank you. We as a commission, again, before we became a commission, we had 17 outfits. We had 6 zonal centers, one in the northwest, northeast, southwest, southeast, north central, and south-south. There are zonal centers. Then there are some states that also have our centers there. And what the commission is doing is from top down and bottom up through our regulatory activities. What do I mean by that? Whatever we do at the headquarters is transmitted through our normal processes to the zones, to the states, to the local government, and to the wards. And over a period of time, and that's why we are seriously talking about regulation. And at the headquarters, we regulate the zones. The zones regulate those states that are under them, and each of the states is expected, and we're talking with the state government, to have their own blood service in the state that will regulate the blood at the local government level. And each local government should be responsible to regulate those that are under them, and we'll have a way of collaborating across governments. So again, we are on NTA. We are also collaborating with other agencies. We are collaborating with NYSC, FRSC, NOA, and these are agencies that have grassroots presence. So through them also, we are making sure that this advocacy and sensitization get to the grassroots. And I can tell you, with the print and the visual media and all the social media, we are doing all we can to make sure that these things are done. And of course, this is not easy because they are not free of charge. It requires a lot of funds to take care of this place and make sure this information gets out to the grassroots. So we are only appealing to government to understand the critical need of blood at every level of governance and make sure that there is proper investment in making sure that safe blood is available for Nigerians.
Thank you very much. Acting Director General, National Blood Service Commission, Dr. Omale. Thank you for being on the spot.
Thank you very much.
Okay.
Have a good day.
And thank you so much, viewers, for always being there. We'll always see you next time, the next episode. Goodbye.